Hallmark project. So first we tested cranial nerve 1, which is the olfactory nerve. The entrance is through the nasal cavity and it exits through the olfactory bulb. The medical term or condition is anosmia, which is complete loss of smell.
So I'm going to test your olfactory nerve. So I'm going to show you I'm going to give you two odors, one good, one bad, while the other is closed, and we're going to see if you can identify the scents. What was the scent?
It smelled very strong. It smelled like acidic. So it smelled like nail polish remover.
Okay. And the second one?
It smelled more like airy and light. It smelled flowery, so like with some perfume.
Okay.
So the abnormal exam finding would be reduced ability to smell and the way they perceive odors. The next cranial nerve is cranial nerve number 2, which is the optic nerve. The entrance is through the retina and it exits through the optic disc. The medical term or condition for this is orbital cellulitis.
I'm going to be testing your optic nerve. So to test this, I'm going to have you look at a Snellen chart and cover one eye and read the first 3 letters, and then we'll do the same with the other eye. You can cover your eye.
A, B, C, B. A, B, or B, E, F.
So the abnormal exam finding for this test would be optic nerve damage. Next, for cranial nerves 3, 4, and 6, they were all tested together. So for cranial nerve 3, we have the oculomotor nerve. The entrance is through the orbit and it exits through the superior orbital fissure. And the medical term or condition for this is head trauma. Cranial nerve 4 is the trochlear nerve. Its entrance is through the midbrain and it exits through the superior orbital fissure. And the medical term or condition for this is cranial nerve 4 palsy. And then cranial nerve 6 is the abducens nerve. Its entrance is through the brainstem. It exits to the superior orbital fissure. And the medical term or condition for this is cranial nerve 6 palsy.
I'm going to test your 3, 4, and 6 cranial nerves. So I'm going to have you follow 4 terms.
The abnormal exam finding for this is ptosis or bilateral internuclear ophthalmologia. And last but not least, cranial nerve number 5, which is the trigeminal nerve. Its entrance is through the brainstem and it exits through the superior orbital fissure, the foramen rotundum, or the foramen oval. The medical term or condition for this is trigeminal neuralgia.
Can you please puff out your cheeks? Okay.
And the abnormal exam finding for this is sensory deficit or brainstem dysfunction.